Good morning. It is Tuesday, May 7th, 2019. Yeah, I probably sound like pure, got a bit of I don't know if it's allergies or a cold. I hope it's not a cold. Anyway, had my surgery yesterday, and all went good. It was done. It's actually over with sooner than expected. From basically beginning of surgery to shortly after I woke up in recovery was less than 2 hours. So anyway, I'm quite sore, and that's to be expected. But I'm tolerating the pain pretty well. I'm taking my hydrocodone. I'm waiting on my Dilaudid prescription to be filled because my neurosurgeon was out on vacation when the surgery was approved and scheduled. So his nurse practitioner, in her infinite wisdom, decides she ain't going to prescribe Dilaudid for my pain. Now, me and him had already discussed it, and it was decided that we would go ahead and, in this one, I would get Dilaudid because of the pain, because of what was going on. But it wouldn't be done until right before the procedure, just long enough before to get the prescription filled. So, Thursday, he's back in town, he's seeing patients, and I had to be over there where he was seeing patients anyway, so I stopped in and he wrote me the prescription for my Dilaudid. Problem is, Walmart has to order them. They don't keep them in stock in the store. So I won't get my good pain meds that will help until Thursday at the soonest, if not Friday. So I'm not too happy with her. It's not his fault, it's her fault. So I just have to muster through this. When I had the procedure done originally, because it was just going up my spine, it didn't hurt near as bad. It has been a blessing. I'm actually feeling less pain. We did a temporary setup just to get the pain relief started. I got to go back in 2 weeks and do a follow-up with my doctor's office. At the same time, the person from Boston Scientific is going to go ahead and set more programs up and fine-tune it. And it'll probably take a couple more times meeting with them to get it done right. But it's worth it. The weird thing is, in my back, in the upper left rib cage area, maybe 2 ribs down from my underarm area, it hurts like I've got a bruised rib. And the weird thing is, they didn't do anything up in that area at all. And what I think happened is when they were rolling me off the table in the operating theater, maybe I hit the edge of the table or something with that area. I don't know. But I do know it hurts like you wouldn't believe. And it makes it hard to keep my balance because I'm trying to fine-tune the discomfort between that and where the surgery sites are. So, yeah, it's been kind of interesting. Unbelievably, last night I slept very well. Now, I dozed off in the chair in the living room. It's about 11:45, and woke up at 2:30. And I was very, very sore right then, and it was past due to take some kind of pain med. So I went ahead and got up and went to bed and took me a hydrocodone. And I managed to fall asleep pretty quick after that. And I woke up and it's 7:30. So it's now I'm safe to take another pain med. And I really don't want to. I know yesterday before I left the hospital they gave me a shot of Dilaudid by IV. And it made me a little nauseous on the way home. I'd stopped and grabbed something to eat, but it was a little spicy, so I think that's what caused me to be nauseous. But I got home, and then several hours later, it was safe for me to take hydrocodone. So I took one, and that made me nauseous again. And I think it was because of the effects from the Dilaudid and the surgery and all that all so close together. Because the one I took last night, in the middle of the night, didn't make me nauseous. But yeah, that's pretty much the update of what's going on. It's going to be a very interesting week for me. Supposed to take the old lady to work today. I was going to go ahead and drive her to work, but I'm just telling her to take Uber. I'm definitely not in shape to drive today. Not with the way I feel. So I'll just lay around the house doing nothing for today. And that's going to drive me insane. But then I'm going to say this. If you have chronic back pain, excuse me, even in your neck, if you have chronic pain in your neck, discuss the neuro stimulator implant from Boston Scientific with your doctor, with your neurosurgeon. It is a blessing. I know I'm talking kind of low. It's because of my throat being messed up right now. And it's not my lower throat like a cold is. It's upper throat like sinus drainage would cause. So, anyway, it's definitely worth the discomfort that you'll go through after the surgery. We refer to it as a puck. And it's about, I don't know, maybe 1.5 inches, 2 inches by 1.5 inches, 2 inches roughly. And that's implanted in either your right upper buttock area or your left upper buttock area. The leads can go up or down your spine. Now, if you're doing your neck area, there's going to be at least one more incision, if not two, than if you're just having your lower back done. So, you are going to be a little more sore than I was. The old lady had the leads put into her neck because she had surgery in her neck. She had a couple of bad discs. She's still recovering. Yeah, it's been... I hate these updates. Trying to do a video, and Facebook does its pop-ups anyway. Go figure. Anyway, she's still sensitive. Probably more than most people. Go figure. Anyway, I was going to do this video live. And YouTube, in its infinite stupidity, has made it so you can't do a live video on your phone unless you meet the criteria of having so many thousands of views per video. Which is ignorant. That means I can't be sitting at my doctor's office and decide I want to do a quick live video. I have to wait till I'm home. That is ignorant. I have never seen anything so stupid in my entire life as how YouTube is doing. There's another form of doing videos that's not through YouTube anymore. It's through Twitch. And I'm actually considering checking them out because of how stupid and petty YouTube has become. I have never seen anything in my life like this. Oh, well, we're not going to let you monetize your videos, but we're going to put commercials in there anyway and just not pay you because you don't get so many thousands of views. And then a year later, oh, and we're not going to let you do live videos on your mobile device anymore. Like, what the hell? Anyway, that's YouTube for you. And technically, because they're allowing some people to do it, they have to allow everybody to do it. And it's up to somebody if they want to sue them. and they would probably win because of how YouTube is acting. And so many people are getting tired of it. If you saw the number of people I've seen complain about YouTube and their stupid policies, then you would understand. But anyway, I'm going to end this video because I don't feel like talking too much, but I'm just recording this and then uploading it. And I'm going to be checking on that Twitch platform and seeing what it's about. And if I decide I like it, that's where I'm going to be going with my videos. Screw YouTube. Oh, and by the way, then I get to sue YouTube because I'll be having fun because I don't need their streaming platform anymore. Let's see what happens. Anyway, please comment, like, and subscribe, and I'll catch you on the flip side. I'll give you some periodic updates over the next week of how I'm doing. Have a good week.